Heart sounds are heard at 4 distinct locations on the chest wall, which correspond to the points where blood flows through the aortic, pulmonary, tricuspid, and mitral valves. Aortic area situated in the second right intercostal space. Pulmonary area located in the second left intercostal space. Tricuspid area positioned in the fourth left intercostal space, and mitral area found in the fifth left intercostal space. The first heart sound S1 occurs when the atrioventricular valve closes after the atria have ejected blood into the ventricles. The second heart sound S2 arises when the aortic and pulmonary valves close immediately following the ejection of blood from the ventricles. The time interval between S1 and S2 represents ventricular contraction, whereas the time interval between S2 and the subsequent S1 marks the relaxation of ventricles. S3 is a low-frequency heart sound heard after S2. It results from rapid ventricular filling. It is physiological in young, healthy individuals. It can also indicate cardiac issue like cardiomyopathy or constructive pericarditis. S4 precedes S1 in late diastole, caused by atrial contraction forcing blood into rigid, non-compliant ventricles. It is often is a sign of systolic dysfunction and can be heard in conditions like hypertrophic cardiomyopathy and systemic hypertension. Heart murmur is a soft, abnormal sound heard during the heartbeat cycle, typically caused by turbulence of blood flow in the heart or blood vessels. It is divided into systolic and diastolic murmur. Systolic murmur is an abnormal heart sound that occurs during the contraction of heart, whereas diastolic murmur is abnormal heart sound that heard during the relaxation phase of heart. Systolic murmurs can be heard in mitral or tricuspid valve regurgitations or aortic or pulmonary valve stenosis. When there is valvular incompetence at the level of mitral or tricuspid valve, it can make the first heart sound S1 quieter or less distinct because the valves are not closing tightly. It allows some blood to flow back into the atria during ventricular contraction. On the other hand, in aortic stenosis, this is a condition where aortic valve narrows, limiting the blood flow from the left ventricle to the aorta. This causes a distinctive systolic ejection murmur, audible during ventricular ejection. Pulmonary stenosis is the narrowing of pulmonary valve, impeding blood flow from the right ventricle to the pulmonary artery. The murmur is harsh systolic sound heard during ventricular ejection as blood is pumped into the pulmonary artery. Diastolic murmur can be heard in aortic valve regurgitation, pulmonary valve regurgitation, mitral valve stenosis, and tricuspid valve stenosis. In aortic valve regurgitation, when aortic valve fails to close properly, causing blood to move back into the left ventricle during diastole. As blood moves into the opposite direction, the murmur is most clearly heard along the left sternal border rather than the aortic area. In pulmonary valve regurgitation, when the pulmonary valve does not close properly, then it causes the blood to flow back into the right ventricle during the heart's relaxation phase. Mitral valve stenosis murmur is low-pitched rumbling sound heard during the diastolic phase of heart, caused by restricted blood flow through the narrowed mitral valve. Tricuspid valve stenosis murmur is low-pitched rumbling sound heard during diastole, caused by restricted blood flow through the narrowed tricuspid valve. Thanks for watching. Do not forget to like and subscribe.